Have you ever felt pressure or tightness in your chest and wondered, is this just heartburn or is something wrong with my heart? What if I told you that your heart can actually send you warning signals before a heart attack happens? Today, we're talking about angina. What it is, why it happens, the difference between stable and unstable angina, and when chest pain becomes a medical emergency. Let's jump in. What is angina? Imagine you're driving your car uphill. Normally, the engine gets all the fuel it needs. But what happens if the fuel line is partially blocked? The engine struggles. It still works, but not as well. Your heart works the same way. Your heart muscle needs a constant supply of oxygen-rich blood to pump properly. When it doesn't get enough oxygen, it sends you a warning signal. That warning signal is called angina.
In simple terms, angina is chest pain or discomfort caused by temporary reduced blood flow to the heart muscle. Why does angina happen? So why does blood flow decrease? There are two main reasons. First, the arteries that supply blood to your heart become narrowed by fatty deposits called plaque. This process is known as atherosclerosis. Think of it like a water pipe getting clogged over time. Less space means less blood can flow through. Second, sometimes the coronary artery suddenly tightens or goes into a spasm. Even without a major blockage, this temporary narrowing can reduce blood flow and trigger chest pain. Either way, your heart isn't getting enough oxygen, and that's when angina occurs.
Types of angina. There are two major types of angina: stable angina and unstable angina. Let's start with the most common one: stable angina. Stable angina usually happens when your heart has to work harder. For example, walking uphill, climbing stairs, exercising, carrying heavy groceries, or even emotional stress. Your heart needs more oxygen during these activities. But narrowed arteries can't keep up with the demand. The result? Chest pain. The good news is, stable angina usually improves within a few minutes after resting or taking prescribed nitroglycerin.
Symptoms. People describe angina in different ways. It's not always a sharp pain. Many people say it feels like pressure, tightness, squeezing, or a heavy weight sitting on the chest. Other symptoms may include shortness of breath, fatigue, sweating, anxiety, pale skin, cold hands. The discomfort may also spread to the left arm, shoulder, neck, jaw, back, or even the upper abdomen. How is angina diagnosed? If your doctor suspects angina, several tests may help. An electrocardiogram, or ECG, checks your heart's electrical activity. A stress test shows how your heart performs during exercise. An echocardiogram uses ultrasound to look at the heart's structure and pumping function. And if more detailed information is needed, a coronary angiogram can reveal blocked arteries. Treatment for stable angina. Treating angina isn't just about taking medication. Lifestyle changes are just as important. Quit smoking if you smoke. Eat a heart-healthy diet. Maintain a healthy weight. Stay physically active with your doctor's approval. Manage high blood pressure, diabetes, and cholesterol. Doctors may also prescribe medications that reduce your heart's workload and improve blood flow. What is unstable angina? Now let's talk about the dangerous type. Unstable angina is different. The chest pain may happen while you're resting, or with very little activity. It may feel stronger, last longer, or become more frequent. Unlike stable angina, this is a medical emergency.
Unstable angina can be an early warning sign of a heart attack. Never ignore it.
Diagnosis and treatment. Doctors perform many of the same heart tests, but they'll also order blood tests to check for signs of heart muscle damage. Most patients need to be admitted to the hospital. Treatment may include rest, oxygen if needed, medications to improve blood flow and reduce the heart's workload. If severe blockages are found, procedures such as angioplasty with stent placement or coronary artery bypass surgery, often called CABI, may be necessary. One important reminder: during the early stages of unstable angina, strenuous exercise is not recommended until your doctor says it's safe. Let's quickly review. Angina is your heart's way of telling you it isn't getting enough oxygen-rich blood. Stable angina usually happens during physical activity and improves with rest. Unstable angina can happen even at rest and should always be treated as a medical emergency. If you or someone around you experiences chest pain, especially if it spreads to the arm, jaw, or back, or is accompanied by shortness of breath or sweating, seek emergency medical care right away. Your heart works for you every second of every day. Take care of it. If you found this video helpful, don't forget to like, subscribe, and share it with someone who might benefit from this information. Thanks for watching.
Like, share, and subscribe Thera Pray.